back, everybody. Sorry for the technical difficulties. I gather we started down the conversation around vaccinations and something went haywire. So we're going to start over. Let's talk more about vaccinations and get back into that conversation. It's an important one and one we have really focused on. So Dr. Bronson, talk to us a little bit about this. We have been asking people, encouraging people to get vaccinated. We've been providing information. Tell us a little bit about the clinics that are happening on campus.
Absolutely. Actually, right out here, we are holding clinics every Wednesday. We started those yesterday. We also have clinics available September 1st and the 8th. And maybe you're not quite sure if you want to get a vaccine, but you want to learn a little bit more. We do have our vaccine ambassadors that are going to be out here and in the plaza and available to talk to you. So if you have questions about the vaccine, you're ready to get the vaccine, we encourage you to sign up.
That's great. And that's also an opportunity to learn more. So your vaccine ambassadors are fellow students who are also trained to work through some of the questions, but they can also access a physician, yeah? Dr. Reeder?
Absolutely, yes. Dr. Reeder has made himself available and helping guide folks through that conversation. If you are not comfortable reaching out to Dr. Reeder, we still recommend you reach out to your healthcare professional and provider and have them walk you through sort of the pros, cons, what are we thinking around vaccines. But we do encourage everyone to have a conversation, and we're here when you're ready to get that vaccine.
And we're adding a few sweeteners to the pot because it is helpful to the campus community for those students who decide to get vaccinated. So we've actually incentivized this. We're offering some scholarship drawings, and that's going to start happening. The first drawing, I think, happens at the first home football game, which would be a week from today, right?
That's right.
Next Thursday night. So if you haven't quite got there and you're looking for a little bit of a helpful nudge, go ahead and take care of that as soon as you can, and you can do that as soon as, each Wednesday, right?
That's right.
For the next few Wednesdays.
Yep, and it's not too late to put your name in the pot for that full ride scholarship. So by August 30th, we want you to upload the vaccination, and if you have questions, concerns about that, email us at safety@coloradomesa.edu, and we can help you know where that upload is, know where that e-form is. It's easy, but we'd love to know. Yep,
and there's just on the COVID-19 webpage, right?
That's right.
There's an opportunity to go on, click on that website, and upload your vaccination, and there it is right there. So just go ahead and click on that, bring it in. That will alert us that you've been vaccinated. That also will get you out of the regular testing regime, and will put you back into only testing if you're symptomatic.
That's right.
So make your life a little bit simpler in the coming weeks
and
and
if
months.
you're still deciding and whether or not to get a vaccine, it's not too late. So if you decide to come September 1st or the 8th, we still have great prizes that we're going to be giving away before September 10th.
And we should probably say one of the reasons why we've chosen to make vaccines encouraged and not mandatory is to give you as students and families the ability to go at your own pace, because the reality is that there's a lot there. We want to make sure people are making good choices, feeling informed, demonstrating personal agency, really exploring that critical thinking that we want to see from the entire campus community, frankly, on a lot of issues beyond COVID. And so there's no deadline necessarily. It's really going at your own pace, but we would encourage you to just be actively considering this, actively doing the research, actively working to get those questions answered.
Exactly right.
The other piece we've heard a lot about is mindful masking. What does that mean? And can we talk a little bit more about what that looks like in a classroom setting?
Absolutely. And really, mindful masking is about respect, right? We all know that we're coming at and have an understanding about COVID where we're doing sort of a risk analysis for ourselves around what does this really mean? Protected, unprotected, and really mindful masking is about engaging in the conversation. So I'm walking into a classroom, I notice that my professor is wearing a mask. If I'm going to be sitting in the front row, be mindful of that and think about putting on a mask. If you're going to be someone who is in a close proximity in an indoor space, think about engaging with the person that's there. Ask them. Maybe I sit down next to you and you're wearing a mask. I may ask you, are you comfortable that I'm not wearing a mask? Would you prefer that I mask up?
Yeah.
And that's really the conversations that we want people to have when they're thinking about who they are, who the other person is, and what conversation is needed to continue to move that forward.
I had a great conversation with a colleague about this very topic, and the concept here is really pretty simple. You know, let's not assume that I know as a colleague or a fellow student or somebody else as part of the campus community, let's not assume that I know what your health situation is. And let's not assume that I know what you're going home to. You may have a high risk, grandparent or someone in the home. You may have some kind of a health complication or be otherwise immunocompromised. And so for us, really, that mindful masking is rooted in humility. It's rooted in respect and asking our fellow members of the campus community what is helpful. Now, what that means is we all need to be prepared to have a little bit of compromise and extending each other some grace. So we would encourage you, keep a mask in your pocket. And if you come across somebody, whether that's an office hour with a professor, whether that's a professor who's at the front of the class and just says, hey, look, if you're going to be sitting up here, would you do me that courtesy? This is something we can work through together. And it's key, again, to us saying, we're not going to mandate masks. We're going to ask you to engage in that conversation, to be respectful, and to really use this as an opportunity, as a trust-building exercise for all of us here on campus.
I think it's an important reminder to our entire Maverick family that we are basing this decision right now based on the landscape of what we know like COVID looks like on our campus.
Today.
There may be
That's
changes that we need to make as we understand COVID transmission and what COVID looks like. So I think going prepared, I think about if you're going to go to OSP and you're going to go to the OP program, and you're going to go out on an outdoor trip, you're not going to go hiking without your backpack and some water. So as you go into that classroom, as we think about COVID preparedness, go in with your mask and just know that the terrain and the conditions may mean that you're going to need to wear it.
Yeah, and some faculty may feel very comfortable not having a mask, and so not a big deal. And the students may be the ones saying, hey, we'd really rather wear that mask. So this is a two-way street. This is an ongoing conversation, and one we hope is continued to be rooted in respect for one another as a Mavily. So please help us in that conversation as we move through. Dr. Bronson, we also talked a little bit about what that means in terms of the overall campus climate. And so maybe we'll take a minute and talk a little bit more about this idea around what is it around this campus culture that we're hoping to accomplish in the coming semester, in the coming year. And it's what I've really started thinking about as the human scale university. And what that really means is we're engaging with one another in relationship. We're being in community with one another. And there's a variety of ways that happens, but one of the ways, as we talked about, is in the classroom talking about masks, but it's much, much bigger than that. It's paying attention to the work and the value that each one of us brings to this university. So whether I'm a custodian or a chemistry professor, we really all bring a different set of value and unique perspective to the campus. One of the members of our campus community that we're highlighting out of the gate as being one of our champions of a human scale university is Dr. John Siebach. And Dr. Siebach is here today. We're glad to have you here, John. Thanks so much for joining.
Thank you, President Marshall. Dr. Bronson.
Yeah, we're thrilled to have you. And for those of you at home that haven't met Dr. Siebach before, he's a professor of archaeology here. But Dr. Siebach, you have a really interesting story. We highlighted this last week with the Board of Trustees because it's just such a great story for what our university is about and the unique work that our faculty are doing in their fields of study. Tell us a little bit about the work that you are doing and how that ties into maybe some national news that we've all been reading about.
Okay, I will. Thank you all. Since 2016, I've been working on locating the lost cemetery of Indigenous children who were buried at the Grand Junction Indian School. The Grand Junction Indian School is one of those notorious boarding schools that was opened here between 1886 and 1911. And during that time, there were at least 22 individuals who were buried on the campus there. And over time, the location of that cemetery has become lost. So Grand Junction and the Grand Junction Indian School has a role to play in the national conversation we are having, spurred by some of the findings in Canada, where hundreds of unmarked burials have been found at residential schools all in different parts of Canada. And now there's a national inquiry being started by the Department of the Interior to come to terms with that legacy of the boarding schools here in the United States. And so as a result of my work, or because of my work, I've ended up collecting reams of information on the Grand Junction School, and I've been able to really speak to that effort to not only talk about where or try to locate the cemetery, but also the history and what happened there, who attended the school, and those kinds of issues as well. And all of this is building towards an archaeological effort to locate the cemetery subsurface. We plan to go out there in the next several months to do ground penetrating radar. We've had cadaver dogs on the campus, and we're really trying to find those young boys and girls who lost their lives. And this is, of course, an issue that is of major importance to descendant communities, to the indigenous communities, not only here in Colorado, but all over the nation.
Dr. Siebach, I have read, like many, that our new Secretary of the Interior, Deb Haaland, has made this a priority. She visited campus a few weeks ago. We were able to communicate with her about your good work. How do you see your research fitting into this national conversation?
I would say that the research here in Grand Junction is part of that larger story, in the sense that there were 28 federal Indian boarding schools all around the United States, but primarily in the Western United States, which at that time, was Indian country. And so there were many, many schools that were opened where pockets of Native populations were heavy. So Grand Junction was opened primarily to educate or to assimilate Ute children. But then the Ute decided that they would rather their children go a little bit closer to home, and so the Fort Lewis School was opened in Durango. The Grand Junction School thereby started getting students from New Mexico, Arizona, Nebraska, all over adjoining states. And so it was really a very cosmopolitan campus. And so it's a very interesting school in that there was such a melting pot of people here. And I do mean melting pot in its sense of the American plan to sort of everybody give up their ethnicity, because of course that was the point of the boarding schools, was that children were being assimilated into American culture and were being asked to give up their indigenous identities. So it does fit into this larger national story of some of the things that indigenous communities have had to deal with over the years, some of the things that may have started the generational trauma that we see in those communities today. So Grand Junction definitely plays a role in all of that.
Dr. Siebach, tell us a little bit. I know you've had communication with the tribes. What role are they playing as you're thinking about the project specific to the Grand Junction School and your scholarship? What's that dialogue like with the tribes currently?
The dialogue is pretty good. The tribes, of course, need to be the ones to decide what happens with the actual human remains or graves once we find them. Obviously, because they are the descendants of the people who went to the school, they need to be the ones to decide what is culturally appropriate for those children. And I know, based on my work with several of the tribes and with a task force that has been started by the Colorado Department of Human Services, who administers the property today, many of the tribes have talked about making sure to bring medicine people up or religious professionals up in order to do ceremonies that are appropriate for those children and for letting those children's spirits rest in ways that are indigenous rather than Western.
Sure. And Dr. Siebach, I know in conversations with you, you have more research that you're looking to do. Tell us a little about that and maybe next steps as you see it.
At the Indian School specifically?
Yeah.
Yes. Yes, so in the next few months, we are planning to do a program of ground penetrating radar. And ground penetrating radar is just one of a battery of techniques that we hope to use on the campus in order to quite literally see under the ground, to see any disturbances and see if we can find any of the grave shafts that were dug. And once that's done and we are able to map those, the location of those graves, we hope to have, or I hope to have, the area set aside and commemorated, either with some sort of public art piece, definitely signage, talking about the heritage of the school, and just to make sure, my main thrust is to make sure that this memory is not forgotten.
Yeah.
One of the things that I found talking about this in my classes has been that many students in the area have not heard of the Indian school. So this is, as an educator, this is shocking to me.
Yeah, it's vital that you hang on to some of those things. And I understand we have a photo of that I wonder if you might share with us.
We do. This is a vintage 1909 or 1910 postcard that was printed here in Grand Junction.
My goodness.
That shows an overview of the school as it looked at that time. It was only going to be open for a couple of more years, but what you're looking at is the campus for Grand Junction residents, or for people who know, looking at the school from what is now called Riverside Parkway. So that's looking north towards the campus. And,
Amazing.
And,
And
yeah,
you say that's 1910?
1909 or 1910.
Wow.
Yes.
Remarkable.
And this is just something I ran across online, and of course snatched it up. And
That's
now
amazing.
this sits on my office, in my office by my desk, to make sure I stay
Great
on
conversation
task.
starter.
Yes.
And yeah. And so Dr. Siebach, you've been 9 News and national newspapers. I understand, your phone continues to ring off the hook.
It does.
So in addition to doing the core of your scholarship, it's also a great opportunity for the university to be able to highlight sort of the broad array of scholarship and service to the region.
Absolutely.
And so from that perspective, I would just tell you thank you for continuing to lead in this area, in helping our students, but really helping the region. And I think that's really emblematic of the kind of work our faculty do every day.
Thank you.
So we thank you for that.
Marshall. No, thank you very
for
much
that
for the
work.
opportunities to do what I do.
Absolutely. Well, we're going to continue to try and highlight great work like Dr. Siebach's. Each conversation, even though it is somewhat dominated by COVID, but we're going to continue to bring some of the human scale stories of this university to the campus community each episode that we air here. So, all right, we're going to pivot to questions. If you have follow-on, we can provide you with Dr. Siebach's information from the website. Just a fascinating story and a really world-class talent that we've got on the faculty.
Absolutely.
But maybe let's head back to Q&A. I know we've got questions coming in from parents. And it looks like, Karen, thanks for your comment about data and evidence. I think we've committed to that 18 months back, and we're remaining committed to that evidence. And today, that evidence feels relatively good, but that could change. And we need to be, I think, remaining focused on what the data and evidence is telling us so that our campus approach is right. And we appreciate your comment, Karen.
Yeah. We had a question here. Dana, I appreciate the question about asking why we're continuing to push vaccines if we think that we're at about an 85% inoculation rate. Maybe you can help them sort of understand where we have come to with protective immunity and the difference between protective immunity and just immunizations.
Yeah, so we view protective immunity, of course, as more broad than simply the vaccine, right? Our vaccination rate is one thing. We know that the vaccine is exceedingly effective at preventing COVID. But the other thing that we have really interesting data here in Mesa County in the context of many months now of Delta, and that is reinfection is really, really rare. As of today, that number rests at less than 0.5% of our cases in Mesa County have we seen a reinfection. On CMU's campus, our reinfection rate thus far has been 0.
That's right.
Now, we don't anticipate it will remain 0, but as long as it remains really, really rare, like on the order of fractions of a percent, we know that either having had the virus or having been vaccinated adds a level of protective immunity that gives us a high level of confidence that we can continue to operate with one another in a low-risk environment, right?
Yep. And I would also say to Dana, the reason why we continue to promote vaccines is even if you have had COVID, there's good data out there that also shows that getting a vaccine adds to your protective immunity level. And so we are still going to make that available and certainly willing to have a conversation around safety and efficacy for anyone that's interested.
And at the risk of using a sports metaphor, I think that 15% or so that we think is a pretty small number of not having protective immunity, we'd love to run up the score a little bit and continue to winnow that down so that we have as few cases as possible of COVID on campus.
That's exactly right. It's a win-win.
That's right.
The more that we grow that number, really the safer that we know that our campus community is.
We had another question about masking and what good does it do if one is wearing a mask and others aren't wearing a mask or something like this. I wonder, Dr. Bronson, if maybe we take a moment and reference back to what we learned at the beginning of the pandemic about the difference between an N95, a surgical mask, a cloth face covering, what the purpose is and what the benefits are.
Yeah, absolutely. There's lots of different types of masks out there, and this has been part of our mask education that we've been doing with the freshmen as they've been moving in. And really when we think about when we started out in the pandemic and really our response was about flattening the curve, ensuring that we had system capacity to be able to take care of people, we really were looking at a way to be able to also ensure that we would have enough PPE or protective equipment for those that were working in the medical field and working kind of front lines around COVID.
Yeah.
And so really out of that came the cloth face covering of being a way that we can do some source control, meaning if I'm coughing or sneezing, that I may be able to contain some of that virus. What we have learned is there's different efficacy, meaning there's different ways that masks work. And one of the things that we've really been diving into is the literature around the various differences between cloth versus a surgical mask versus an N95, and really trying to help people understand what each of those entities do. Are they protecting me? Are they protecting those around me?
Yeah.
And more importantly, what is my own risk profile and what type of mask should I wear in certain situations?
The university has procured quite a few of all of the types of masks. So we have a good supply of N95s, we have a good supply of surgical masks. And so one observation that I would make for you is if you're someone who is looking to just be a good neighbor and you don't have any symptoms, you have protective immunity, a surgical mask is perfectly good. That's a way to extend respect to somebody else. You are controlling your ability. As we said, my mask is for you, your mask is for me.
That's right.
If I'm somebody that has a heightened sense of risk or is immunocompromised or for whatever reason has that heightened sense of concern over their risk, really the appropriate mask for you to be wearing for your own protection is an N95. And so we have a number of those. I know you've made some of your staff available for fittings because that's an important part of that N95.
It is.
And so if I'm somebody in that category, whether I'm a student or a professor or a staff member, how would I go about acquiring that and getting it fitted?
Yep. The best way is just to reach out to our safety team at safety@coloradomesa.edu. Inquire, let us know that you are interested in N95 masks. You're also interested in the fitting. That is really important because we know if we're going to wear a mask right, this is a great way to make sure that the mask is the right fit for you and confers the most amount of protection that it can. So just reach out to our team. We'll find a time to get you both fitted and to ensure that the mask is going to work properly.
Yeah, that's great. So if there's questions about that, continue to send those along, but we appreciate very much that ongoing dialogue. Again, respectful conversations around campus is really central to this, and marrying it with evidence so we know that our behaviors are based on our overall risk factors. And so we'll continue to monitor that very closely, and as conditions change, we'll communicate that with you and make sure that the campus is fully aware of what's happening so that we can all make good choices.
That's right. I'm going to continue to promote vaccines. So if you are interested, we are going to be right out here at Escalante Hall on the patio, September 1st, September 8th. It is not too late to get your vaccine record uploaded to enter in to win a full ride scholarship.
It's amazing.
It is amazing.
We are grateful for the ongoing partnership with you all, both members of our campus community. Thank you for continuing to be in the boat and rowing with us. For you parents and students at home, thank you for trusting CMU and being a part of our Mavely. With that, I think we'll wrap for the week. We look forward to seeing everybody in a couple of weeks right here. Take care.
Take care.